Reflex and why I wrote that paper, which was published in Indian Journal of Neuroscience in 2017. The reason why I wrote that paper was because there are many circumstances and situations in which we are not able to perform the way we should. How is that and why is that? When we say performance, means like we are appearing in an interview, in an exam, in a play sport, or in any gathering where you have to act or do whatever social activity. Sometimes you are so good at it and sometimes it just walks away from you. Why is that? Because there are certain reasons which we have to understand. What we are living in is a state of conditioned reflex, which is wrong. Conditioned reflex, when you're talking about, is that you are living in a state in which you have been told this is what it is, and then you start getting used to it. You start getting habituated to that concept, and slowly you perform in that concept. But what we forget that the actual development of the brain is not this. When you talk about intelligence, when you talk about intelligence quotients, I don't know how many people, millions of people must have gone through this test so many times. Now, this test is done in a specific form of sets like patterns. I'm sure everybody must have appeared in this test of intelligence quotient, but I totally disagree with the way they have made this since past 100, 200 years. It's all written in the paper who did what, and chronologically it's been written. But the idea was that you don't have to measure the outside response. What you have to actually measure is what is happening inside the brain without any external stimuli. So what you have to focus on is the cerebral activity of the brain. Because that is where the cognitive wave is getting produced within each and every one of our brains. And what you and the other people before are doing is that you have to perform a test. A set of questions is given, 15, 20 questions are given, or maybe 100 questions are given, and then you say that this is the pattern and you have to tell me which is the next pattern. Or if small mathematical equations in which you have to sometimes predict the next number. But finally what happens is that what we fail to understand is that when your brain is getting processed with this, when you're processing your brain with this, what is the condition of the brain at the time when you are answering these questions? Now, why I am saying this is because there is a reason behind, like we have deep reflexes, we have knee-jerk reflex, we have, ankle reflex, we have all these kind of, we've all learned it in the medical career, upper motor neurons and all Babinsky sign and Koenig sign and everything. So we know all about deep reflexes, tendon reflexes. But what if I tell you that you have this, what is called as a cerebral reflex, which we can label it as an intelligence reflex. With that is what is to be measured at every moment in time. It's changing. So there's nothing known as a intelligence quotient. That yes, your quotient is 150, your quotient is 70, or you're a moron, you're an idiot, or you're a genius. Now that doesn't work within the brain because we have devised these scores just to prove that label a person whether he's like he can perform his job or he cannot perform his job. So that is a goal-oriented assessment of the person. That is not the intrinsic capability of the person. And that is where most of the students are getting defeated along the way. When you say, suppose there is a batch, like I've seen people preparing for exams, and then they say that this batch is very good. So certain students in this batch are very good, so you can separate them from the rest of the batch, make a better batch out of them. Now, this is because this is wrong. Why should you? You cannot divide on the basis of a particular test or on the basis of just one result, or maybe okay, why one result? I would say not on the basis of 5 results or even 10 results, because ultimately how the child is performing, you've seen it everywhere. You've seen it everywhere. There are hundreds of examples in which people have not been able to cope in college, and then they have performed very well in the later stages of their life. People who are not able to pass exams in the first professional, second professional, maybe appear in the final year exam for 10 years, 5 years, 10 years. I know people who have been performing very badly, but then they have done so well in private practice or in general practice or after graduating that it's impossible to even imagine what they were during college. So why I'm telling you all this is because now I'll come to the point, is that intrinsically each one of us has what we call as a intelligence reflex, which fortunately if you try hard can be measured. And how do you measure this? You can measure this by 2-3 modalities. I'm sure every neuroscientist or neurosurgeon or neurology person listening to me right now would understand what I'm talking about. Is when I say this during the EEG waves, when we see you have this alpha wave coming and then you have beta, delta, theta, whatever. And this alpha wave, when you go a little deeper, can have a breakdown in that alpha 1 and alpha 2, and that desynchronizes with each stimulus. So this medical terminology may frighten some people who are not used to it, but it's all a very simple game, very very simple game. It's easier to do this than to play, I think, tennis. I think, but anyway, what I'm trying to say is that suppose you have a student, or not even a student, a subject, and then you're performing an EEG on it. Now, while you give him a stimulus, any stimulus, so we can safely assume that whenever you're providing a stimulus, that is his thought, because now he knows what he's going to see. So that becomes the next thought, that he's going to see something, change in color or hear a voice or whatever it is, your stimulus you provided. And during that unstartling stimulus, that is very important. During that unstartling stimulus, he responds intrinsically responds and begins to habituate on that stimulus. So the time from which the desynchronization point occurred and the habituation time, you can easily measure it. You can, if you start working very hard, you can. If you got time to see your subjects properly, all these neurology students or people in neuroscience, they can do this very comfortably. So if we can measure this habituation time and at the same time you know the point of start of the desynchronization, can't you correlate the two? Because the greater the time a student takes to habituate, that means from the point of your desynchronization point, you have two variables. The greater the time a student takes to habituate, I think lesser is the intelligence, because something you get over something faster. You habituate faster, that means you're more intelligent than the rest of the person who is taking a longer time. These two variables can be very comfortably fed into what we call as the classification models in artificial intelligence. Now, something like, I'm sure people who studied artificial intelligence must have worked on Kera's classification model, or you have two variables. Maybe you can have 50 variables, but I'm just taking two variables right now. I can give you the example in this, like you have this chest x-ray and you have to find out whether the patient has tuberculosis or not. We made these models ourselves, and while we were studying this artificial intelligence program, and it's simply you have to put an image in it, and the computer tells you, yes, this is, he's a patient with tuberculosis, or the next image, there is no tuberculosis, it's a normal x-ray. And then certain universities went 15, 20 steps ahead, and then they said, like Stanford and all these universities made models, and they said we can even predict what time you're going to die seeing the X-ray. Wow, you know, you can predict the age of death also now. And this is possible because you measure the shape of the heart, then you shape of then you see the angles, and then you see the parenchymal findings, maybe the vascular structure, maybe the size of the portion, the diaphragm of the diaphragm, and the rest of the features which you're getting fluids inside it, you're getting spots inside it, you've got consolidation, and then you've got whatever pneumonia signs and other features which through which you can make out that the person is diseased or not. So you can predict the age of a person. So similarly, when you have become so complicated in dealing with the other anatomical and physiological parameters of the body, why can't you just take this to the brain and predict what the next thought is going to be? Why I'm coming to this is very important, because when you say, I'll come back to that whole theory of habituation time and desynchronized alpha variable. Now, suppose somebody is in a coma, right, and you're not able to talk to him, you're not able to elicit anything out of him, but intrinsically he might be just listening to you, or he might be just able to understand your signal, any signal you provide to him. So these, similarly, suppose you provide a sound to him and he begins to habituate in that sound. Now when he begins to habituate, and you know the point of the time when you started that stimulus, and then you know the point of time, how much time he's taking to habituate. What if you measure it in a continuous purpose? A very simple test, just a continuous purpose. I called it the intelligence reflex test. And in 2017, got a patent, applied for a patent also for it. Now, this very simple test can tell you tomorrow whether the habituation time is improved or has it decreased without even moving a muscle. Your muscle and the patient's, trying to elicit a response from the patient's muscle. You can just find out whether the patient is improving or not. Yes, continuously perform the test many times a day. Maybe just put a monitor and just leave it like that. Instead of a stimulus, start a song. Instead of a signal light or whatever that hurts the person while he's not able to tell you anything, why don't you just you sing something heavenly to him? Maybe he or she responds to it. And at the same time, you can also measure what is happening within the patient. And similarly, you can find out if the habituation time keeps on decreasing over the next few days. She's improving, he's improving. So this is one of the ways in which you can understand the cerebral brain. And artificial intelligence will definitely help you predict how long all this is going to happen. It's going to take, whether habituation time today is x.y and tomorrow it's x1.y, and which is less than x.y. So you know how many times it will take to predict you might be out of the bed. Few months, 6 months, 1 year, maybe not. So this is one of the way to test why I'm suggesting this. Is that what we can do with this kind of intelligence that we all possess? It's an intrinsic cerebral activity that we can possess. This is my first lecture on this, and I'm certain that it would be helpful to most of the people that are listening to it. Thank you.